I'm going to do a tutorial for you for EHR Tutor because I know you're going to have some questions. And really all I'm going to do is just kind of go through the steps that you would go through as a student as you're doing your care plan assignments in EHR Tutor. So I have out in front of me the directions. And I'm just going to choose the medication interpretation assignment just to follow. But the one for the laboratory care plan assignment will be similar. We're just going to show you how to kind of navigate through the program. So here I'm going to EHR Tutor and I'm going to log into the program. And I already logged in just to try to find what I had on here, but you would put your username and your password and whatever, and you would be able to find your course list. Now, it might look a little bit different here at first just because this is an instructor view, but I will show you from a student view once we get into the class. And you'll see that I've created this course here for you, which is your clinical course with me. And so I'm gonna just go to that course. There really is only 2 activities loaded because there's only 2 activities that you're going to be doing in EHR Tutor. Those are your 2 care plans, so your medication interpretation assignment and your lab interpretation assignment. So here is where I'm going to switch over to viewing the activity as a student, and so now this is what you're going to see. And I have just the basic instructions for this typed in here. I wasn't going to type every single instruction on here. I felt that you had that resource, and it was just not necessary to duplicate the work. But just this is telling you what the objective of this assignment is, telling you when the assignment is due. You can see you have 72 hours after your scheduled clinical day to submit this assignment here in EHR Tutor. And then you're going to look to the paperwork that I handed out during orientation to see what the specific objectives are, as well as instructions regarding what you need to put in your work. And then I also reminded you that you do have rubrics that kind of are helpful. I like rubrics. I know a lot of people do. So when we get started, the first thing we're going to do, and I'm looking at my instructions here, and number 1 says scroll to the bottom of the page and add a new inpatient. So you can see here I have new inpatient chart, and so I'm going to select that option, and I'm going to fill in things here. Now remember, you can't put any patient information in your patient identifying information in your chart, so you're not going to use your patient's real name. The best thing to do is just something like what has popped up here, your name and maybe patient 1, or you could put week 1 or whatever. So just that would be sufficient. You'll choose whether your patient was a male or a female, and we can go ahead and put in an age, and I'm just going to randomly pick 78. Provider, you can type in the provider if you would like to. I know that Eric Bannock is a provider that is in the hospital. I don't know if it'll let me do that or not. Let's see. Eric, maybe it won't. Maybe it'll only let you pick stock ones. So let's just pick one. No one cares. It doesn't matter. I like Will Smith, so we're going to pick that one. And then you can see you can add your code status, and this is just basic demographic information. And remember, there is one way I told you could determine a patient's code status being if they were a DNR, they should have a sticker on their chart. But you can also look under your patient orders, and it will tell you whether your patient is a full code or a DNR. So I'm just going to go ahead and put in here that this patient is a full code and save that. Okay, so now I have my patient chart open, and I'm able to enter more data into this chart. So I can put anything in here. I can add x-ray results, I can add lab values, I can add medications, any of these kinds of things I can actually add to this chart. So I'm just going to go ahead To number 2, it says create a patient and a medical diagnosis. So let's see if we can find where, okay, there's my, that's weird, 77.9. I think it keeps a time, so, now it's just, I don't know, that's just strange. It's not really relevant. So we've got provider, results, labs, provider. We can go here to chief complaint and history of present illness, and this is typically a what the physician writes, but we can go ahead and add here because there's going to give us a problem for diagnosis, other problems or diagnosis, principal problem and mission diagnosis. So that's where we've gone. We've gone under provider and we've gone to chief complaint and history of present illness. So I'm just gonna type patient was seen in outpatient clinic for complaints of shortness of breath 5 days ago, was diagnosed with COPD exacerbation and received prednisone taper dose and Z-Pack. I'm just making stuff up, but you can find this kind of stuff in your information or in your patient chart. No improvement noted despite treatment. Patient's symptoms continued to worsen. Okay, so that's just a little synopsis, of what happened. And so my patient's diagnosis, I'm going to actually put a dual diagnosis in here because I'm making this up. COPD exacerbation, and you know what? He's not getting any better because he has pneumonia. So there we go. So that's number 2, create a patient and a medical diagnosis. So I have medical diagnosis. All of these things right here where it says history of present illness and injury, it doesn't seem as though any of this stuff is necessary that you fill out. Feel free if you would like to add that particular information. So I'm going to go ahead and submit that, and that gets put into my chart here of history. So I can now see that this is why my patient came in, and that's my diagnosis. Okay, moving along. Complete the pathophysiology section, therapeutic regimen, and current health problems. And complete this under nurse's notes. Okay, so I'm going to go ahead and go to nurse's notes. And I am going to add a new note. And this is fine, just that this is a nurse clinical note. So I'm going to do a pathophysiology, and I'm going to, COPD is chronic disease, and I'm really going to give a good description of this disease process, so that I can convey what really is going on with the particular disease process. Remember that this is more than just a simple definition. You could include things like risk factors. Let's see, risk factors. You could include things like, some of the symptoms maybe that the patient experienced, yada, yada, yada. So you want to make sure that you are showing that you understand what COPD is and how it's treated. Typical diagnosis, you might say that this is confirmed with a chest x-ray. and expected treatment might be whatever medication regimen uh, or PT or whatever. So we're looking at the whole therapeutic regimen and comparing what is actually being ordered with what might be expected. And so the patient is specifically on these particular things that are consistent. That's consistent with the expected treatment. Sorry, I was trying to think and type at the same time. It's a little bit harder than I thought it would be. Okay. All right. So I've completed a pathophysiology, and like the directions say, it's not really a definition of the medical diagnosis. I'm going to address the functional changes that this patient has experienced. And remember that we're counting spelling, grammar here with this. Oh, speaking of, your pathophysiology is going to be a citation. So you're going to use your in-text citation. Functional changes are going to include what the patient's baseline status was in terms of things like ADL and ADLs and self-care, that kind of thing. And now where are they? What do they need? What do we need to do for them to get them back to baseline? So that's what we're talking about there. We've got our functional changes. Also on here, therapeutic regimen talks about what the current treatment for your patient is. If there's any labs or diagnostic testing, what would you expect? Any other current health problems. This would also be a place where you could list comorbidities and how those affect the functionality of the patient. Okay. So I'm just going down. So now I'm done with number 1, number 2, number 3. Okay, so I've put all that stuff in here. You can see my citation. I've got my in-text citation here, whatever resource it is that I used. And I'm going to go ahead and sign that there. Another thing that I want to point out to you is when you do, because we're performing APA, what I want you to do here is I want you to make a new I don't know if it'll let me type that. No, we'll just make a new nursing note, and we're going to make a reference list. Okay, under a new nursing note, and this is where you will add like your author information and all of that citation, that reference list. So whether it's what you use for pathophysiology or whatever. So make your reference list here as an additional nurse's note in here. Okay. All right, so we're moving right along. The next thing, number 4, says enter your patient's medications for your shift and include PRN. So let's see. So that, I believe, is going to go under MAR, if I recall correctly. Maybe not. That's what we're looking at. Let's see here. Don't worry, we'll find it. This says allergies and home medications. Orders. That's what I want. I want orders. Learning curve for everyone. Okay, so I'm going to go ahead and put in a new order, and I'm going to type DocuSate. No, I'm going to not. No, I don't like that one. Let's type methylpred. There we go. Here, oh, look at that. That's nice. That comes up. Methylprednisolone injectable IV 40 milligrams. Okay, so I'm going to choose that one. And there's my physician. And down here I can add this here. So 40, and I'm going to get milligrams. Actually, I want 60, 80, because this guy's really sick. 80 milligrams for this patient. There's no rate, and I'm going to give this IV, there it is, IV, and I'm going to give this, I don't know what the order is, every 12 hours. That's that. Well, he's pretty sick, so actually it's probably going to be every 8 hours. And then some of these things are not going to be pertinent for how long. Sometimes you may have medications that are for 1 dose or for 2 dose or whatever. So it doesn't, that's irrelevant. And then, whenever that is started, let's see, we want to add any administration comments, student notes right here. This would be a good place to enter information about why your patient is taking this medication. So this is a steroid, decreases inflammation in the lungs, this is legitimate, making it easier to breathe. It can cause hyperglycemia, aggression, weight gain / fluid retention, increased appetite, yeah, so that might be something that you add in there just to communicate that you're understanding what this medication is for. It's used because he has COPD exacerbation. Okay, so I've added that order. Let's see if that works. Okay, so now I have an order there. Okay. This also would be where you would put what you got that information, because you do need to include side effects. Oh, and maybe administer, this one is administered over 2 minutes, IV push, any other type of information that you would need to know for your patient. So we gave this at, I don't know, I think that's somewhere else. That looks pretty good. Administer, oh, and then where did I find this? So, I don't know. There's a legitimate resource, but actually this just came from my brain today. But I want you to use a real resource here. Okay. It's like a drug book or something like that. And we can go ahead and sign that. So now I have an order. So I'm going to add all of those orders there. As I add orders, I can put I will be able to see them in the MAR. So I believe that I can go ahead and add, maybe you can't, no scanner available, submit. No scanner available, submit. And I can add the time that was given. So I can go ahead, given, I gave my 80 milligrams, milligrams. And it charted that. So then I can see that I gave that at that particular time. So on your instructions, when it tells you to add the time of administration, you would do that under the MAR. And so there you go, there's your meds. And then you would do this for all of the medications that were ordered on your patient, especially those that were pertinent. Remember when we talked about the PRN medications, if you didn't give a PRN medication, of course you wouldn't include an administration time, but you would add that on here so you can use that in your care plan. Okay, so next thing on the list, so we've entered all of our medications, is our assessment. So we're going to go down and find our flow sheet. I'm going to add some vital signs to this patient. So I can go ahead and just add my vital signs on here, just like you would for any vital signs, and this is a radial because we're getting manual, and 128 or 78, and he was sitting. We don't really calculate mean arterial pressure. Critical care uses mean arterial pressure a lot more than regular med surg. 24, he's 89%. Let's see, he's on room air. He might need some oxygen. Numeric pain rating scale is the appropriate pain rating scale for an adult patient. So we're just going to say 2. I'm not sure why it has glucose monitoring results under vital signs. That makes no sense to me, but whatever. And anything else, if you feel like you need to do height or weight, like for example, if your patient is a CHF patient, that would be somebody we would do a daily weight on. You can add that there. It's okay. So I've gotten my vital signs in there. And then I'm going to do my assessment, and this is a complete head-to-toe assessment. So you can go in and you can just click whatever is appropriate, and you can click multiple things for your assessment. So you do want to enter the complete head-to-toe assessment in here. And let's see, and then we have some other screening and scales. That's not what I want. Remove that. Others, add clinical institute withdraw. Nope, that's not it. I'm trying to find the Braden and all that. Maybe that's back on assessment. Neurological. Oh, yep, there's the Glasgow Coma Scale for our patient. So we can go ahead and document that there. Respiratory assessment, cardiac, vascular, and integumentary. There's the Braden scale. And it's nice you can see what the levels mean over here. So we'll give you a score. Just pick some things. Excellent. Potential problem. It looks like you have to add it yourself. So 4, 6, 10, 12, 16, 18. So score is 18. And so they're at risk, but not high risk. They're at risk. And then, and here's that fall scale that we talked about, the Morse fall scale. Okay, so just make sure that you get all of your assessment. So I would like for you that day on your patient to document your full head-to-toe assessment. Any other notes or anything like that you can add on here as well. That subjective information is important as well. Let's see, moving right along. So then we're going to go to the care plan tab. That's down here a little bit more. Care plan. There it is, care plan. Here's my care plan tab. And I am going to create a nursing care plan including 3 nursing diagnoses for my patient adhering to the following guidelines. So I have guidelines here for me. So I'm going to do a new nursing diagnosis. Let's see, my assessment of this patient, he's short of breath. His O2 sat is 89% on room air. He's tripoding. And let's see what else. Lung sounds are diminished, non-productive, frequent cough. Okay, so these are some things that I'm assessing because clearly you can see that I am trying to cluster something together here. And so my nursing diagnosis, and you need to use official NANDA nursing diagnoses. There should be a list provided under resources on your Canvas page for this class, but I'm gonna go. Let's see. This is good for. What would be good? Ineffective gas exchange. Related to COPD exacerbation and pneumonia. and it's as evidenced by O2 SAT of 89, diminished shortness of breath, diminished lung sounds. And again, your nursing diagnoses are going to require citation, your in-text citation. Oh no, not the nursing diagnoses. I lied, just kidding. So my goal for this patient is the patient will maintain O2 saturation greater than or equal to 92%. I don't know, within 2 days. So it's specific, it's measurable, it's achievable, it's realistic, and it's time sensitive. So now, interventions. So my interventions are what needs to be cited. I'm not going to look these up or anything like that. I'm just going to put them on here. So I'm going to administer oxygen per protocol to maintain SATs greater than 92%. And the reason that I'm going to do that is because whatever your rationale is, logically, I can say the patient has compromised lung function at this time, and providing oxygen is going to improve gas exchange. I don't know how legit that is. Sounds good, but I'll find that in my book. My other intervention that I'm going to do, and you can see if I administer oxygen to keep SATs greater than 92%, that gives me the ability to titrate that. So if I need to have 2 liters or 4 liters or 3 liters or whatever, then I can use that as far as how I implemented that intervention. But it's going to move me towards my outcome up here of keeping my O2 SATs over 92%. Something else I'm going to do is I'm going to encourage the patient to cough and deep breathe. And my rationale for that is that this keeps the alveoli open for optimal gas exchange. All right, and so by encouraging my patient to cough and deep breathe, I'm also going to help achieve my outcome there. And then the other thing I'm going to do, because remember I'm working with a medication plan, is I'm going to administer the steroids, the solumedrol, methylprednisolone per MD order. And the rationale for this is going to decrease the inflammatory response. And ultimately make it easier for the patient to breathe. And that's going to increase the improve the gas exchange, and that also moves my patient towards the goal of maintaining O2 saturation. Okay, so let me see how I'm doing. Nursing diagnosis related to, as evidenced by, expected outcome, interventions. I've got my 3 interventions. I've got my rationale. Okay, now I'm going to evaluate this. So here's my evaluation. Patient was placed, I can't type, placed on 2 liters per nasal cannula. O2 SATs remain 92% at this time. Patient demonstrated cough and deep breathe independently reports, let's see, doing exercise 10. Okay, so here's the evaluation of my interventions, and I'm also going to just note here that my evaluation of my outcome it is being met. Now, we have to decide, are we done here, or do we need to continue to monitor this? So, patients on 2 liters of nasal cannula and O2 sats remain 92% at this time. That's our goal, is being met, so that's wonderful. So we're just going to continue treatment. Wean O2 as tolerated to keep the sats above. And monitor the patient. Monitor the patient. Okay. All right, so there we have our evaluation. So I'm going to submit that. So my status is ongoing. See where it says ongoing? Okay. So then when I need another nursing diagnosis, I can go ahead and put that in there. Okay. So now we've moved down our list. Interventions, we've done evaluation. My care plan, if I go back and I look at my care plan, everything is cohesive. These are assessments that are related to my respiratory problem. All of my interventions, my planning and everything kind of fits one another. My interventions move towards my outcome. So here we have an evaluation. Any additional information that you want to add to that, you definitely can, and you would just choose an edit for that, and you can go back in and you can edit things. If you're, are working on your care plan and it's resolved, like it's done, then you can hit resolve. But this one is ongoing. We want to keep working with this patient. So I think that we've kind of have walked through everything in here. If there are other things you feel like you need to add to your chart, as you're going through here, if you want to add your patient's allergies, you'll need to add all of your medications. I do want to point out, please add under student notes those things. That I'm going to say is not something that I see in the directions, other than to complete all of the fields for there. So I think that it is important. I'm going to just open this back up again. When you look at the new order, let's see, let's go. What else is this patient going to take? They're going to take Avalox. Moxifloxacin 400. Okay, they're going to take this. I do want to fill out all of these fields that are appropriate, but in these student notes, you need to include, those pertinent monitoring parameters and why that patient is actually taking that particular medication, so that you can demonstrate that you understand what this medication is for. So I hope that you found this tutorial useful. I really just kind of worked through it with you. So, I personally haven't been in here a lot. So the more that you get in here and play around, the easier it's going to be for you to kind of navigate through this. If you have any questions at all, please don't hesitate to ask me. I'm more than happy to help you get through this. I know some of these things can be challenging, time consuming, a little bit difficult, especially trying to make everything sort of fit together. So, you know what? There should be a place for labs too. Mm, results, I bet. Yeah, lab. So you can go in lab. I forgot to mention that. You can go in here and you can put your lab values in here when you want to make mention of that. So it is going to take a little bit of time to complete this assignment. So please don't hesitate to reach out if you have questions, and I will do my best to help you get through this. So good luck.